Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Okay, Doreen, would you be kind enough to do roll call?
Amo, Anagnostakis, Ellers, Fagione, Lujan, Sutherland,
Here.
Tortel, Tui. 5 present, 3 absent.
Okay, thank you so much. Commissioner Miller, did we give you enough of a break there before you jump up and start the next report?
Well, good afternoon, everyone. How are you?
Afternoon.
I know, right? I'm sorry, I didn't realize I talked for so long last time. Okay, so I'll be very quickly, just to say, the New York State proposed budget has a number of positive things. It really doesn't have any cuts. I didn't say that for the last meeting, but either for social services or for the mental hygiene system. In fact, has some pretty bright spots if they actually go through. So we're monitoring very closely what comes out of that budget. I didn't mention on here, but there's an RFP out for crisis stabilization centers. So an intense crisis stabilization center. There are 12 for the state. 3 will go to New York City. 9 will come to the rest of the state. We fortunately have a provider who qualifies. It has to be a 501c3 that's either licensed with DOH, OASIS, or OMH. We have a provider who's excited about applying on behalf of Orange County. It will take stakeholders. It's an option to divert people from emergency rooms, to have a place where, an alternative where police can bring people for stabilization. It's walk-in, it's, child, youth through aging, so it serves all populations. It's anticipated to have about $1.4 million funding annually, state deficit funding, about 3.5 in Medicaid billing, 3.5 million. It's pretty exciting. So hopefully we will win out over our partners across the region. So we'll see what happens. But I think we have good partnership and a good foundation to see that happen. Let me just see. Oh, the expansion with the police, really great. We had sorry. Yeah, I'm sorry. Go ahead, Legislator Lujan.
Thank you, Madam Chair. I just really briefly want to comment on the Stabilization Center. Commissioner, you and I have had the chance of talking about this over the years, and this is actually a project that I have always been very, very supportive of. I actually I work in Dutchess County as well. Actually, just the other day was in the Stabilization Center in Dutchess County with a client that I work with, and I can tell you it is really what we want our care to look like. Really intentional, really quality care, really trying to meet people where they are. And I think that Orange County really, with the work that the commission has been doing is phenomenal. I think this is only add on to the great work that they're already doing. So it's exceptional. It's a project that I think it would start off in Texas, if I'm not mistaken, the first stabilization center.
We brought you... One and I was sorry that, but we brought the guru in from Texas, right? We were so excited about this.
It was like 6-7 years ago.
Yeah, I know. Yeah.
I was definitely not a legislator then, obviously, but it's really revolutionary. It's really ahead of the game. It's what they did in Dutchess County. It's really amazing, and I think that having neighbors so close that are doing a great job. I think we can even do better. And I think that that's kind of, if we're able to bring it here, it's really going to change our model because it provides police officers and health providers another tool in their tool belt. And it's just such a great extension of trying to connect people to services. People who might need housing, people who might need services, people who might be just, it gives another touch to a person who's struggling with drug addiction. And so I just think it's such a phenomenal project. So I really do hope that we get to move forward with this. And with the chairwoman's permission, if we could maybe one day try to see what the Dutchess County does and even do a visit, I would love for other legislators here to get to see that because so you don't just take my word on it. It is really exceptional, and the staff that I've got to work with just in Dutchess County were amazing. So we'd be very fortunate. So I think that would be a great initiative for us to have. And I know the district attorney seemed very excited about a stabilization center here too. So it seems that we're all in the same direction. So I love that. Thank you, Commissioner, for that report.
I've been to the Dutchess County Stabilization Center. It's wonderful. Agree. It is a supportive stabilization center. This is an intensive model, so it does include doctors and nurses and prescribers. So it's above a step above as far as the intensity of care, but no less important to have the supportive work that's being done in Dutchess County. And they were the forerunners. They did it. They got it up and running. Lots of money, lots of county commitment to make that happen. So let me just say the Assemblywoman Gunther money to expand our crisis continuum, which will complement a crisis stabilization center. Really doing great work with the chiefs. Chief Iwanshu over in Middletown, he said we'll co-locate a peer here once his dispatcher's trained. We're on the cusp of having 911 be able to transfer calls to 311 and 311 back to 911. Do the same with Middletown. So this is focusing Middletown, Mount Hope, Port Jervis, and Wallkill. Really will intensify our services. All of the providers, agencies are hiring the staff now. So it's just good work. We're just going to see phenomenal outcomes from it. I'm sure of it. The Children's Mental Health, we talked about the expansion of the system of care that can only assist with our collaborative response. I don't know if I printed off an old report. I think I printed off an old report. Doesn't matter. We had the meetings with our pediatricians and our prescribers. We're moving forward with a product. We're very excited to expand collaboration. All of us have agreed that that's the direction that we want to go so that mental health providers are communicating with pediatricians and that we will have a foundational list of those who are friendly to treating and supporting young people who have mental health challenges and prescribing for them. Little difficult because it's not easy to access them readily, which I was just speaking to Jackie Lawler about from the health department. The other good work that's being done, we have submitted the application for Monroe Woodbury to New York State OMH, so hopefully that satellite will be off the ground and we can move to one of our next schools. We will begin with our healing communities, so the funding from the SAMHSA to Columbia. We are a Wave 2 funded community. We will be receiving those funds and become active in July. That will complement very well some of the work that we're already doing and also what we hope to use some of the settlement funds for. And we have a plan to meet with the county executive sometime early March. He's going away, I'm going away. So we're going to meet in March to talk about next steps for that.
Okay. Legislator Lujan, question?
Thank you, Madam Chair. I had a question in regards to, and this might kind of have a range, but I did see that there was a lot of federal funds coming through for harm reduction. If you might be able to speak on that and kind of like what the range of what that looks like, because I think there was a lot of discourse around it, but like not a lot of information about like why this is beneficial, where we've seen it work in other places, like 2 decades even in some countries. If you could maybe perhaps talk a little bit about that and what that would look like for us, how we would be using harm reduction techniques. Will it be in the jails? Will it be, or are we going to be training our social workers, our caseworkers? Is it just kind of like integrated in how is that?
Are you talking harm reduction for prevention? So things like fentanyl strips are harm reduction. And so we're currently doing that the Narcan boxes that we're looking to place throughout the community, going through our coalitions to have those Narcan boxes out in the community. Those are all harm reduction efforts. I think when you go to probably the most controversial, is because we have needle exchange and whatnot available in the county also, but it's really the sites where people can go and safely use their illicit drugs. That's very controversial. And that's really life-saving. And some people really feel like, you're promoting people using illicit drugs by having those sites. So we would have to be a county that was ready, hearts and minds, to receive that type of harm reduction and have a community that was willing to be the home for that type of a facility. There's been much talk about upstate New York had some, the first 2 New York, and now down in the city, I think they just opened 2 centers. I would say this, I don't think we're a community that's there yet. Our hearts and minds aren't there to have this facility. I think we're doing everything we can other than that. And I don't know whether we'll get to a place where that will be a level of harm reduction that we'll provide here in Orange County.
Legislator Fagione?
Thank you, Madam Chair. Thank you, Commissioner. And just for clarity, Orange County does not have a facility that provides needles to allow people to use illegal drugs in Orange County, correct?
No, but we do have a needle exchange program that is mobile, where people can exchange their needles. So that's really, and we have our health department here. They can really talk about how that protects people from getting, physical health conditions that can be chronic and or fatal.
And the funding for that comes from where?
I believe it comes through the OASIS, through New York State
the
Office
state.
of Alcoholism and Substance Abuse. Yes, it's not local funding.
Okay. Thank you, Commissioner. Thank you, Chair.
Could be Department of Health, though.
Yep. Legislator Lujan?
Thank you, Madam Chair. Yeah, I really did appreciate you talking a little bit about that, because while I do recognize that it is very controversial, and I do want to kind of reiterate, for some of us who have worked in human services for a long time, who have worked in the jail, who have worked in social services, who have seen it working for the last 2 decades in other countries, when we see that the immediate reduction to STDs, our county, for example, leads in STDs amongst a certain age range that are also those who are using illicit drugs. So when we talk about this, we have done certain techniques for a very long time. Some of them work. Some of them have their limitations. I do hope that this body could, with the data, with the information, consider and look at what works and what is working in other places, because that's how we really address and really save lives. So I just wanted to end with that point.
I would just add to the Hearts and Minds piece, choice around addiction is the first use. For some, it no longer is a choice from them forward and ultimately becomes a chronic condition, a chronic illness, and a chronic disease. And in order to kick that, there's treatments that are recommended, and many people go through 5, 10, 15 relapses before they found long-term success with recovery. So I agree with you. We need to have hearts and minds understanding what addiction is and what motivates people to seek out the worst drugs of all, like fentanyl.
Okay.
Okay, thank you so much. Have a
it?
good afternoon.
All done? Okay, thank you so much for that. Okay, next up, we have Dr. Gilman, Commissioner of Health.
Hello. Good afternoon, everyone.
Good afternoon.
Can you hear me?
Yeah,
Okay, just
yeah, you're
double-checking.
great. So first up, we have a request to create 4 public health fellow, 2 grade 12 positions. They will be contingent on grant funding and shall be automatically abolished upon cancellation of such funding. Legislative request 19. Do I have a motion and a second? Okay, go ahead, Dr. Gilman. Thank you.
Thank you, Mrs. Chairwoman. This is a request to create 4 public health fellow, 2 grade 12 positions as stipulated positions. As was mentioned, they will be contingent on grant funding and shall be automatically abolished upon cancellation of such funding. There were a total of 19 positions, 15 of which have already been approved and confirmed. Similarly, these are the 4 remaining positions.
Okay, great. Legislator Lujan?
Thank you, Madam Chair. Just a quick question. So for individuals or people in the community who might want to apply for these fellowship programs, what would be the best route for them to do so? Are we actively seeking through
I think, go ahead,
sources?
Jackie. Yeah, so I think we've staffed for them, but I'll have Jackie.
Yes, yes. Hi, Jackie.
Actually, could you come up to the microphone, please? Thank you.
So the best way for them to actually apply for it is through New York State Department of Health. So what we're doing, it's a kind of a meshed approach to this. So they have to apply through the New York State Fellowship Corps program. It's right on their website. So it's super easy. If you can't find it, email me and I'll send it to you.
Would you, Commissioner or Jackie, would you please send that to all legislators? Just because I'm sure that we have some great talent in our community that might want to participate. I actually have someone that I would like to have them go there as well, to see if they qualify for it.
Yeah,
I'm sure
absolutely.
other legislators have the same thing, so,
Yep.
this is a great program. This is something we want our community to take advantage of, and we want to.
Yeah, we are still looking for a couple of positions. So the other thing too is we can put it on our website or something like that too, so that it's more accessible.
Actually, if it could be sent to Doreen in the legislative office, that would be great, and then she'd be kind enough to send it out to
We still have positions available, so it's a rolling basis through July of 2023.
Excellent.
Great, thank you.
There is Fellow 1, I believe, is a bachelor degree, and Fellow 2 is a master degree, and there are specs that will be included in the link,
That's excellent.
and there's a description with it.
Excellent. Thank you so much.
Thank you.
Okay, great. So we'll do a roll call on that, please.
Amo,
Yes.
Ellers,
Yes.
Fagion? Lujan? Sutherland?
Yes.
5 ayes, motion passes.
Okay, great, thank you. Next up, we have a request to create one biostatistician, I think I said that right, grade 14 position as a stipulated position. This will be contingent on grant funding and shall be automatically abolished upon cancellation of such funding. Legislative request number 20. A motion and a second, please. Mr. Legislator Fagion, Legislator Amo, thank you. Okay.
Thank you, Madam Chairwoman. This is a request for one biostatistician position, grade 14. It is, once again, a stipulated position and would be contingent on grant funding and shall be automatically abolished upon cancellation. We're actually very excited to have a biostatistician on board. It will be a great addition to our epidemiology division as far as biostatistics are concerned.
That's great. Any questions? Nope. This will do roll call. Okay, thank you.
Amo,
Yes.
Ellers,
Yes.
Fagion? Lujan? Sutherland?
Yes.
5 ayes, motion passes.
Okay, thank you. And now if we can go into the monthly update, that would be great.
Thank you very much, Madam Chairwoman.
And I just want to thank you for always getting the reports out to everybody, giving us an opportunity to read them ahead of time. So, thank you for that. I don't know if
Absolutely,
you
and
wanna
thank
just
you for
highlight or what
acknowledging
you
that.
want to do.
Actually, I'm quite excited to deliver this report because our COVID update is finally showing an analysis that's projecting a very sustained decrease. I'm actually very glad to report that. As you are aware, we have quite an abundant wastewater surveillance COVID-19 analysis project. It's actually a very comprehensive program. We're very proud of it. It's, I would say, the most abundant one in the state, if not the nation. There are over 400 data collection points in the nation currently, and we are one of the very few, if not the only county that actually have 6 points of collection in all of our densely populated areas. So clearly, as a predominantly well-water county, it may not be a complete picture as far as wastewater, because obviously this is gathering information from municipal processing plants. But nevertheless, even for that half of the data, it's quite indicative of overall transmission, and it gives us an early means of detection and early means of notification, because it's obviously the viral burden is apparent in water about a week to a week and a half prior to actually seeing the symptom presentation and the lab confirmed results. So it gives us really some time to operate with early detection. I'm very happy to report that the quantifiable results are showing a decrease in the viral load for COVID-19 in municipalities throughout the county, and it does coincide with what we are also seeing with the reported positive cases in the county. As far as a general overview, the department call center continues to operate. Calls have, again, glad to report, have slowed down quite a bit recently. We still have questions from the public regarding a number of issues pertaining to COVID-19, but we are refocusing some of our effort to really fundamentals of public health. So we're welcoming all of our other 60-plus communicable disease surveillance and early intervention and other programs, our community health outreach, our health equity, and now we have an upcoming community assessment project that's coming out. So we're very excited to really revert back to the fundamentals of public health. February is America Heart Health Month, an initiative that raises awareness about heart disease and ways to prevent it. So please visit our website or the website of the American Heart Association for more information. And I am glad to finally include more information other than COVID-19 as far as safety. In terms of just the last bits on COVID-19, I know you have the report in front of you. Our nursing division continues to hold vaccination clinics. We are continuing with our vaccination point of dispensing, but we are sort of in a divide and conquer mode. We're really concentrating efforts where we have the least vaccination rates, such as with our schools, with our nursing homes, with some of the populations that either need that final kind of pushing over the threshold, such as the nursing home population, which is predominantly vaccinated at this point. Again, I'm glad to report. We're still vaccinating our homebound populations. There is quite a bit of room for improvement on vaccination of our 5 to 11 populations. We have one of the lowest vaccination rates for our 5-year to 11 years old. Last time we were tracking it, we were at around 14% vaccination in that demographic, which is way below the average for Mid-Hudson and definitely much lower than the statewide. For 12 to 17, it's slightly better, but again, very, very low vaccination rates. So we are urging just parents to speak with their providers, with their pediatricians regarding vaccination of our younger population. But other than that, you see the report in front of you. We have decreases on all fronts. We are still seeing active cases, but it's nowhere near what we have seen throughout this last Omicron wave in terms of transmission rates. So that's where we are, definitely as far as American Heart Association and the heart health, and also flu shots. We are seeing some flu activity, not as prevalent as in years past, but there is the New York State flu tracker if you're more interested in the granular detail as far as the week by week. Shorter report on other benefit of COVID.
We appreciate you. Yes, Legislator Amo, question.
Thank you. I think the congratulations are all across. I think this is kind of a standing ovation for everyone.
Mike, I'm sorry, can you turn on? Thank you.
I think there's a question we probably want to think about asking, and you don't have to answer because it may not be prepared. But if I were to say to you, what are 3 things that you've learned as a result of dealing with this previous pandemic that you're ready to change when the next one happens?
So there are a number of takeaway points. Clearly, we actually have some viable metrics, but without kind of going off script. Definitely communication in terms of improving communication, and hopefully some of actually what you've voted on today as far as the fellows and reinforcement in the ranks. We're very glad to have the extra staff available to really just revamp the list of community stakeholders, all community stakeholders, because if nothing else, there's this one emerging theme throughout the pandemic, how crucial communication truly is to getting that message across all sectors. So I think fundamentally communication really stands out. Health equity is a secondary piece, and I'm very glad to say that Orange County was kind of yet again ahead of the curve as far as us being one of the very few departments that actually hold a health equity grant and have held a health equity grant even prior to the pandemic, and having a health equity director, but definitely improving and expanding upon that. There are some unfortunate side effects of the pandemic with regards to ramifications to public health in terms of just reestablishing that trust in public health, because I think there are fundamental similarities regardless of kind of where you stand and on what side of the aisle you are, whether it's religiously, politically, or otherwise. And fundamentally, I think everyone can agree that everyone wants safe food, safe water, and other safety parameters in place as far as communicable disease. And even notwithstanding COVID per se, but there are a number of other communicable diseases. If I was to toss out Ebola, if I was to toss out measles, if I was to toss out tuberculosis, I think everyone can agree we don't want active tuberculosis spreading rampantly. So in terms of just communicable disease, getting back to the fundamentals, as I've mentioned, of public health, and that's why for the last couple of weeks, we've really been reformatting and just meeting on getting back to basics and getting that message out to our local communities, our local municipalities, and ensuring that we are, first of all, communicating what the specific concerns may be for each community, because they do vary even across our county in terms of what the chronic disease conditions look like, what perhaps opioid, smoking, a milieu of other issues that pertain specifically to that community. So the hope is moving forward that we can reestablish some of that trust in public health, in really hearing the concerns from each, even municipality, and again, reinforcing and reestablishing that communication. I think that's going to be paramount moving forward.
I think it's just a follow up on that question is that, I mean, you and I have talked, I think, about this before. Trust is critical. Communication is a big word. There's some smaller words that help out. The thing I'd like to hear later is, what are you going to do differently? We all know communication is a problem and trust is a problem. So what are we going to do to build better trust? We talked about, not your starting, but a state, county, nationally, the initial approach that everybody wanted to get tested. You want everybody tested. And then when you tested them, there were consequences of enforcement. We ran into my community, oh my God. So what did they do? They said, let's not get tested. Because if we get tested, they're only going to punish us.
The don't test, don't tell Florida approach to the pandemic,
Yeah,
yes.
I mean, and that's just a mistake in terms of the approach, whether it's communication or trust, but that is a mistake. You don't want to send people into the rabbit hole, so to speak.
Absolutely.
You got to be able to invite them out. And I think some of the stuff, like you mentioned, the stakeholders are so critical. I think that sometimes we,
And
who's prepared for this? That's the point. There's not many people in the country can raise their hand and say they were prepared for such a pandemic.
right, and not just pertaining to COVID-19, we've always had a lot of the community stakeholders at the table as far as immunization coalitions and a number of different coalitions as far as community health assessments, so on and so forth. But I think post-pandemic, it's a completely different landscape. So it's very important to reconvene those stakeholders and really reassess what that landscape looks like now post-pandemic, and really engage a lot of community stakeholders yet again in a new conversation, because interestingly enough, we've convened our immunization coalition, but it's drastically different. And by immunizations, I mean all immunizations outside of just COVID immunization or vaccination. And it's interesting what that looks like. I mean, there has been some hesitancy in even vaccinating pets with rabies clinics. We have rabies clinics coming up. And I know public health does that too, but even with rabies and that hesitancy with regard to your pet and just overall conversations that I believe all of us can be having at a higher level at this point.
Okay. Well, be interested to see, as you're saying, what you're going to do. I think even the first stage is, identifying the issue. Now, what's your strategy for making sure that we communicate better and get more trust going forward on all these plans? But that's great. Thank you. I mean, and I compliment you for being so forthright, because I think some other people in the political world would not want to talk about that kind of thing, because my God.
Thankfully, I'm not in the political world. I'm in public health, very much entrenched in it.
I'm not saying I didn't do anything right, because they're going to blame me, my boss, for it. So, we don't want to do that. We have to have that conversation. Nobody's wrong. I mean, nobody's wrong. I mean, I think some of you may have heard, but the Dr. Gottlieb, if I got his name right, I mean, he wrote the book and he came out and said, the CDC was absolutely the wrong place to control it, to go after this. We needed the Pentagon, we needed, FEMA, we needed a lot. Why was it there? They're a research group that really understands,
Maybe not ideal to have lab researchers communicate anything to the general public. I mean, again, lessons learned.
Yeah, I mean, so there's a lot of good things we can learn from it, because it will happen again, I suspect.
Hopefully not, but
Hopefully not in our time, we won't see it, but that was a really good question. Yeah, and I think a conversation about what we could have done differently, and what we could have done better, what we, nailed, I think would be a really good conversation to have at some point. Legislator Fagione.
Thank you, Madam Chair. Quick question for you, Dr. Gilman. First of all, thank you for communicating with me over the weekend. Dr. Gilman gave me a phone call on Saturday about an issue. So just to follow up on our conversation.
Yes.
One of the topics that's come up in my community, and perhaps even in Orange County and throughout New York State, is the idea that our students in our schools currently are being told that their masks have to be worn. Just for clarity, at what level of government is that order currently being held over the state of New York in terms of, is it federal government, state government, or county government who's making the decision as to whether or not those masks have to be worn on students in our schools?
Absolutely. Thank you for that question. And I know that comes up quite a bit, especially now. That's a very debatable, but also very front burner issue. So the CDC comes out with the general overarching nationwide recommendations. However, the actual mandate, as it may be, is coming from the New York State, specifically New York State Department of Health, and New York State Department of Education is the one that really disseminates that information broadly among schools. So it does come out on the New York State level, and that's kind of how it trickles down as far as masking and other protective measures for schools. You're welcome.
Okay, Legislator Lujan?
Thank you, Madam Chair. Is it accurate that I believe the state said that they were going to be revisiting for schools, I think it was in March, based on if our numbers are still continuing to decline as we are thankfully seeing that? Was that
Yes.
still accurate, or has something changed since then?
So that's absolutely correct. As everyone is aware, the masking overall in New York State, that mandate has been removed, but that does not pertain to specific settings. So those are healthcare settings, adult care facilities, P through 12 school settings, and schools obviously of all sorts, homeless shelters, and public transportation. So those were the vicinity. As far as the governor's office and what they have communicated, after the winter break, they will reassess what the numbers look like, and that's what they will kind of use as a gauge to see whether those protective measures will be removed. And of course, the masking being sort of the last protective measure that's in place for schools, because as we all know and are aware of, all other protective measures in a school setting, which is a congregate setting, have been removed at this point, with masking being really the last frontier.
And you said that the CDC has actually cautioned that we should actually not be going in that direction yet.
Correct. So as far as the CDC, and there are a number of studies that are available, because that's another sort of topic of debate. Unfortunately, it's used anecdotally and not necessarily with research data. So the MMWR has published an actual study on masking efficacy and how effective various types of masks are. And clearly any intervention, and I don't know if I'm making this apparent, but it is available on the CDC website. It's available on the MWR website. So obviously having no mask in place provides absolutely no protection. So if there's an infected individual, they're passing on droplets and bodily fluids. If you have a cloth mask, and I kind of caution you as you go along, any intervention, whether that's pharmacological or otherwise, if it's on the shelf, it doesn't have proper use. So everything has to have its intended and proper use. So masking worn on your chin is not going to be protective. A mask that you've had from the beginning of the pandemic that's standing upright on its own probably does not have much efficacy. If you haven't washed it from the beginning of the pandemic, and it's been over 2 years now, probably not very effective in containing disease. But in terms of cloth masking and efficacy, as far as actual randomized studies and the results of research studies, a cloth mask has 56% lowering odds of transmission, meaning that it provides a barrier. So there's 56% lower odds of transmitting or contracting. Now, a surgical mask obviously provides a higher degree of protection, being a medical grade mask. So a surgical mask, again, if it's disposed, if it's not the same one that you've used throughout the duration just to kind of gain entrance into stores. So that provides 66% lower odds. A respirator mask, N95 and KN95, and I caution you here yet again, KN95 masks may be used. They have to be well-fitting. If they're oversized or undersized, they're not going to have a proper fit. But when used properly, and N95 masks are actually the highest degree of protection, but they have to be properly fit tested. meaning that there's no leakage and there's a proper seal, because that's the highest degree. But when you do have that fit test for an N95, or you have a properly fitted KN95, there's an 83% lower odds of transmission. So all that's saying is you're containing your bodily fluids when you're wearing it, and when the other individual is wearing it, they're also containing their bodily fluids. So that's as far as mask efficacy. Now, I do urge individuals, especially parents or anyone that takes care of younger children, because this is a discussion as far as schools. Now, in schools, we are on the course, and I'm very glad to report, to remove masks in schools. But this has been kind of the discussion that I've been having for the past number of weeks. Parents need to be aware of what our local statistics actually look like. We have, and I reiterate kind of to the beginning of our conversation, one of the lowest vaccination rates for 5 to 11 and 12 to 17 in the Mid-Hudson as well as in New York State. So please have those conversations with your pediatricians because all that means is, and this is in no way of statement in support or sort of for or against masking in schools. This is simply, it really goes toward informed consent on the part of the parents. There really needs to be an understanding of this narrative where COVID-19 does not impact children. 25 to 30% of all of our active cases have been in residents in Orange County under 18 years of age. So every single time during the pandemic when we have measured new cases in individuals under the age of 18, 25 to 30% on average have been in children under the age of 18. So what does that number actually look like? 19,655 cases from the beginning of the pandemic in Orange County have been in individuals under 18 years of age. And every single week, and this has increased during Omicron, kids are quite adept at transmitting and transferring COVID, and this even taking into consideration that there's not as frequently tested as adults. Because when you have a number of children in the same household, typically they're not tested, they're just treated as if they've had COVID. As far as hospitalization and hospital data, because the conversation really then kind of de-evolves into, well, it's not really an issue. We are seeing quite a bit of evidence as far as long-term COVID. So even when the COVID symptoms resolve, and I'll get to hospitalization and presentation to medical facilities in a second, long-term COVID in children, and this is kind of the sequelae after COVID. What happens after COVID? We are seeing evidence of, and again, not a conversation, multi-system inflammatory syndrome or anything that will render you in a hospital or something that will force presentation to a medical doctor. This is even in asymptomatic presentations and kind of that mild to moderate case presentation. We are seeing evidence of long-term COVID, neurological sequelae, endocrine, cardiovascular issues other than respiratory in nature that are lingering long-term. And this is despite multi-system inflammatory disease syndrome. So as far as schools specifically as a setting, and why schools, because that's also the question that's been posed quite a lot. If we've removed masks elsewhere, why in a school setting? And again, this is New York State Department of Health, but what the premise is for New York State Department of Health actually keeping masks in school. So individuals in school are there for 7 hours a day, hopefully. They're not skipping school. They're in very close proximity in a very densely populated sort of environment. And the protective measures that I've discussed that have been in place when we resumed in-person activities in schools. So for instance, social distancing. Social distancing has been reduced in schools. We went from 6 to 3 feet with the idea that there will be a properly fitted mask. So currently, obviously we have no social distancing practices because at best you have 3 feet, if that, because it was impossible to have in-person activities with a lot of children in a classroom. So the idea was we will reduce that social distancing in a school environment to allow for in-person activities. And the caveat to that was this well-fitting mask. As far as ventilation, you're hearing a lot about ventilation. There is not one school that I am aware of in Orange County that currently has a HEPA MERV 13 grade filter, which is actually what it would take to filter out COVID-19 particles. And the schools that may have one randomly, that's not available in all classes, in all environments in that school. So ventilation as a protective barrier is, again, not in place. In terms of vaccination, I think we've amply covered vaccination, that Orange County happens to be an area of very low vaccination, specifically among 5 to 11, as I mentioned, 14%. And 12 to 17 is also very low as compared to Mid-Hudson and the rest of New York State. So we don't have that as a protective measure. And again, this is not a commentary. This is really, again, just discussing protective measures that are or are not in place in schools. So we don't have vaccination as a protective measure. Obviously, sort of the cleaning we established early on in the pandemic response that there's no fomite transmission. So cleaning is neither here or there. It's great for other public health concerns, but not necessarily for COVID-19. As far as quarantining of individuals that have been exposed to a positive case, there is no quarantining in New York State as of January 18th of contacts because we've suspended contact tracing. Now, if the school is aware, they may notify an individual, but as of January 18th, there is no contact tracing in place. So that has been removed because the idea is that we are off-ramping. As I've explained kind of early on, I'm very glad to report that fact that we're seeing a decrease in transmission. It's sustained. We're off-ramping from pandemic response. But there's a difference between off-ramping and the understanding that we still have positive cases. And as far as removing all risk or providing a quote-unquote safe environment in schools, parents need to be aware of what protective measures are actually in place and which ones are not. So with no quarantining, no social distancing, no vaccination, no ventilation, the last two barriers were test to stay, so we're testing. Home test kits have, at their best use, have absolutely no medical diagnostic value. They're there for screening purposes during times of low transmission. They're not there as a diagnostic test or a medical tool. So that really takes away testing as far as test to stay. Obviously, not even mentioning the fact that majority of tests have been shipped in sub-zero temperatures, rendering them pretty much inert because most of them are 35 to 85 degrees as far as maintenance, but not even kind of digressing into that. So test to stay is not really a diagnostic or a preventative measure. So finally, the last kind of barrier that you have masking that's available to children in schools currently. That will be revisited by the state after after the winter break to see where we are as far as transmission, possibly even calculating in the overall vaccination, because overall vaccination for 5 to 11 is low. It's fairly low. We have much lower rates, but it's low across the state. I don't know what factor it will play in as far as the state considerations for removing masking, but those are the facts that I think are very important. I think it's very important to mention that. And as far as hospitalizations, because I promised to mention that, there is a special report that is available on the New York State website as far as hospitalization in children. It is released by the State Department of Health, and it is broken down by area. So for Mid-Hudson region, hospitalizations in children 18 and under have increased 9 times. In the Mid-Hudson region for the week from December 5th to 11th to the week of January 2nd through 8th. It has increased 16-fold in the New York City area for 18 and under, and about 2 times for all other regions of New York. So in the Mid-Hudson region, hospitalization for kids 18 and under, and this is COVID hospitalization. This is not with COVID, for COVID, anecdotal COVID, suspected. This is actual COVID and complications. What was very eye-opening in that report, and it's quite a lengthy report, you have all the stats available in it, and it's available publicly. Majority of the hospitalizations clearly were among unvaccinated, but that goes without saying, but these were not children with comorbidities or other medical or mental issues. These were children that simply contracted COVID-19 and were hospitalized for complications. Admitted with no comorbidities, 64% were symptomatic. 54% of the children had absolutely no other comorbidities, and majority of them were actually much younger. So it still remains a concern as far as, again, the narrative where COVID does not impact children or impacts them at a lesser rate. That's just simply not the fact. And the reason I've kind of gotten into this protracted explanation is because it's very important for parents to make an informed consent when they are sending children to school, with this acute understanding that this is kind of the last frontier. And as long as everyone is on the same page and understands that there are absolutely no protective mitigating measures in place in a school congregate setting with a very low vaccination rate, then we can proceed kind of being informed and having that knowledge and having that level of acceptable risk.
Okay, great, thank you. Does anybody have any other questions or thoughts? Yes, Legislator Amo. If you could lean into your microphone, please.
You said it before, and I want to write it down. What's the percentage of vaccination for the categories up to 18? You were telling me they were.
Yes, so for 5 to 11 in Orange County, 14%, and that's compared to 36% in Mid-Hudson, and it's a bit higher in the rest of New York State. For 12 to 17, it's 51%.
Excuse me, say it again, 51?
Yes, 12 to 17 years old, it's 51% in Orange County, as compared to 74% in the rest of Mid-Hudson, and slightly higher than that and that's really, it goes to the question, because we frequently receive the question, why are Orange County schools different from, let's say, Nassau or Westchester? In Nassau and Westchester, their vaccination rate, even for their pediatric populations, upwards of 80%. Their overall vaccination rate, which for us, unfortunately, is still around 64%. For Westchester, for Nassau, they're in the 90s. That's why for them, flu is more of a concern in terms of hospitalizations and long-term consequences than potentially COVID-19. So that's really the drastic difference, let's say, between Nassau and Westchester versus Orange as far as Mid-Hudson region. And they're bringing our averages up, and other counties bring them down.
And just probably for another date, but this is interesting, and I don't want to hold us too late, because we got other things to do, but that was interesting when we were talking about it in Orange County way in the beginning. I was shocked because I raised the question about the Hepa filters, especially in the government center. And I was told that it's not the gold, it might be a gold standard, but it's not the only standard.
Correct.
So like our particular systems, I was told, does not accommodate the HEPA filter by size and thing. We have to put another level in there, but it does just about as good. But that raises a question about, going forward, because any viral infection that could be spread by respiratory basis would do better. We'd do better if we had better filtration systems.
I mean, that's always the case, and I think there's no end to that. And the real consideration was when this was brought about for schools, in the context of schools or other settings, other congregate settings, it's really the cost involvement and obviously refitting all of it. Plus, there's really no end to how good it could be. MERV 13 is sort of the minimum baseline. It could always get better, and you could get worse. You could get into ionization and so on and so forth, and other issues on particulate matter. But as far as COVID-19, it's really specific to COVID size, as far as just the virus size, and what would actually filter it out versus other filtration mechanisms. So it is a conversation for another day, but I thought kind of that perspective, specifically for parents and that are interested in the data, I think it's an important conversation for them really to have as far as safety measures in schools with their pediatricians in terms of vaccination and other potential protective measures.
Okay, thank you so much. Any other questions? No. Okay, Dr. Gilman, as always, thank you for your thorough report.
Thank you very much. Thank you. I appreciate it. Stay well, everyone. Have a good one.
Okay, and finally, we have Donna Strecker here from Valley View to give us the monthly financials and the monthly update.
Thank you, Madam Chair. Good afternoon, everyone. For those of you that don't know me, my name is Donna. Lawrence Ledoux sends his regards. He's not able to be here today. He's attending a basketball game for his children. We're going to look first at the results that I sent you for December. This is the second release of financial information for December. It is unaudited. It is preliminary in nature. I will hit the highlights on that for you. IGT, since the last publication, has not changed. It came in at just under 5.8 million. We have received information that we will receive another payment that will cover state fiscal year 10/1 through 3/31/22. So when that payment comes in, I'll advise you. I do know that the provisions that were put in place under the CARES Act to reduce the amount of match on the county remains a reduction from 50%, reduced by 6.2%. Emergency disaster funding under the CARES Act this year, we've received $86,445. Other revenues, our public nursing home revenues is the majority of that. Small amount of miscellaneous revenues there for interest, coming in at $38,391,000. On the personal service side, the December performance so far, we've expensed just under $22 million in personal services. We have equipment that we've purchased at $202,000. On the contractual side, we have still $1.1 million to be expensed, and year-to-date, we've expensed just under $11 million. Indirect cost is the cost for the other departments that service Valley View. That cost has posted its just under 1.9 million. On the employee benefits sides, we're coming in at 16.2, and a small amount of serial bond interest of 104,000.
Any questions? Okay.
If you turn to the next page, you'll see an analysis of payer source types. On the left-hand side, you'll see the bill types that we bill: Medicare, Medicaid, private pay, hospice. The way this breaks out is that on the top, we have the 2021 analytics, and then on the bottom, we have the 2020 analytics. We're ending December with our average census coming in at 74.80. Certainly, the facility is still being impacted by the pandemic.
Okay. Thank you.
And if you turn to the last page, you'll just see historical occupancy.
Can I ask just a question? How do we compare to the region or the state on that number?
Could you just move a little closer to your mic?
How do we compare to the region and to the Hudson Valley and to the state on that occupancy rate?
As my understanding is, it's all across the board. In speaking with other nursing home administrators and speaking with, collaborating with the Leading Age, the New York State Department of Health, it's really a universal problem right now. And, you know, it's twofold. It's the pandemic, and now the other fallout from that is the staffing shortage. And that's being felt universally across the country.
Okay, thank you. Okay, Legislator Ellers.
Thank you, Chairwoman. Commissioner, I'd just like to know, have you seen any increase in employment due to the recent bonus program, I guess, that we implemented?
We do have, so far we've been able to hire one LPN under that program.
So it's just one so far?
One.
Thank you very much.
You're welcome.
Okay, any other questions? Nope, okay.
Moving on to the January results, not a lot of activity going on in January. Much of the accounting finance is focused on the audit for 2021 and wrapping up year ends. We budgeted $7 million in IGT funding for 2022. We've also budgeted surplus of $6.3 million. Other revenues we budgeted at just under $44 million. We did realize revenues, they just haven't posted to the January results yet. On the personal service side, for the first month of January, we've expensed $1.6 million in payroll dollars. We have encumbered money to purchase equipment. We haven't expensed it yet. On the contractual side, we've earmarked $3.3 million. We have that reserved for expenditures that haven't been expensed yet. We've actually expensed $163,527. On the employee benefit side, we're coming in just under $1.2 million and a small amount of serial bond interest at about just under $4,000.
Okay, any questions? Okay.
If you turn to the next page, you'll see that same analysis for billed days. In the nursing home world, everything is occupancy relates to the number of days billed. For the first month of January, we billed 7,654 days out of a possible 11,160. In terms of occupancy, that equates to 68.58%.
Okay. Any other questions? No? Okay. On to the Valley View update.
We have the monthly report from Lawrence. Valley View census today is 67%. We still have 2 units closed. This is a byproduct of the staffing shortage. We just began accepting short-term admissions again. We currently have no positive residents or staff with COVID. All the units have been taken off precautions. Residents can leave the units for activities, visits, and rehab. Visitation restrictions has been lifted as well. The Orange County Department of Health held a COVID vaccine clinic at Valley View on February 9th. 13 residents received shots, 11 boosters, and 1 first dose and 1 second dose. 46 staff have received their booster shots. New York State mandate booster shots for all healthcare workers be in place by February 21st. And we have received 1 referral, full-time LPN, for the sign-on bonus.
Okay. Any questions? No.
Thank
Are
you,
you,
everyone.
okay. Are you, just a quick question, are you anticipating any issues with the booster mandate?
No, not at this time.
Okay.
Yeah, not at all. I mean, I looked at the vacancy. Right now, we have 66 vacant positions. 49 of those are clinical positions, but this is not really related to the mandate. It's just a matter of the pool of employees at this point in time.
Okay. Well, I think that's it. Thank you so much for your report. We appreciate you coming.
Thank you.
That seems to do it. The desk is clear. So can I have a motion to adjourn, please? Okay, all in favor? Aye. Okay. Thank you, everybody.